friends, I'm Dr. Prashant Sharma and you're watching Medicos Hub. This is a series of lectures on complement system and I'm going to compare the various pathways of complement system which we have discussed in the previous lectures. First of all, classical pathway. This pathway is the part of acquired immunity because it can be activated only by the antigen or antibody complex which will be formed at least few days after acquiring the infection. But alternative pathway and Medicos binding pathway, these can be activated without formation of antibodies. So these are considered as the part of innate immunity. Now initiation, this is initiated only by activation of antigen antibody complex, interaction of complement with antigen antibody complex. This pathway is initiated by interaction of complement with antigens. This pathway is initiated when the mannose binding lectin and the MASP complex interacts with certain carbohydrate residues on the plasma membrane. The first complement to participate is C1. The first complement to participate is C3 and the first complement to participate is C4. The formation of C3 convertase. C3 convertase in this pathway is C4b2A, while it is C3b-BBP in this pathway and it is MBL-MASP C4b2A in this pathway. The C5 convertase in this pathway is C4b2A3B and in this pathway it is C3b-BB3BP and in this pathway it is MBL-MASP C4b2A3B. And finally, this is common for all pathways. Now we'll compare the three pathways of complement system in tabular form. Activator for classical pathway is antigen antibody complex, while in case of alternative pathway it is antigen, while in case of mannose binding lectin pathway it is a carbohydrate residue which is usually D-mannose. The first complement to be activated in classical pathway is C1. In alternative pathway it is C3, while in mannose binding lectin pathway it is C4. C3 convertase which is formed in classical pathway is C4b2A. While in case of alternative pathway it is C3b-BB. While in case of lectin pathway it is MBL-MASP C4b2A. While the C5 convertase is C4b2A3B. In case of alternative pathway it is C3b-BB3B. We can also place properdin along with it. In case of mannose binding lectin pathway it is MBL-MASP C4b2A3B. This is C5 convertase. Now complement level in serum, because all complements from C1 to C9 are being consumed in the classical pathway, it means that these will be lowered in serum. Their levels will be lowered in serum. In alternative pathway, as C1, C4 and C2 are not utilized, so these will remain normal, while rest of complements are decreased in serum. In case of mannose binding lectin pathway, only C1 remains normal because it is not consumed, while rest of complement proteins are lowered in serum. And because antigen antibody complex is involved, So immunity will be acquired only. While in case of alternative pathway and mannose binding lectin pathway, it is innate. So these are the various points of comparison between the three pathways of complement system. Hit the like button, share and subscribe our channel to get the latest updates and notifications.